So we have a question, which of the following is the most common cause of primary hyperparathyroidism? So they were asking the most common cause of hyperparathyroidism. So we have an options of parathyroid hyperplasia, parathyroid adenoma, CRF, and a decreased sensitivity of PT gland. So in this options, we are very clear that CRF, that is chronic renal failure, is not going to be the common cause of primary hyperparathyroidism, because it is the cause for secondary hyperparathyroidism. So we have the left out options of parathyroid hyperplasia, parathyroid adenoma, and decreased sensitivity of PT gland. All these three are cause of primary hyperparathyroidism, but the question is most common cause of primary hyperparathyroidism. If you are choosing the parathyroid adenoma, it is the right answer. This parathyroid adenoma is most common cause, around a 90% than that of the parathyroid hyperplasia. Let me see what's happening in the primary hyperparathyroidism. See, normally in a hyperparathyroidism, there will be increased in the parathyroid hormone. The parathyroid hormone is getting increased. Whenever the parathyroid hormone is getting increased, due to that, there will be the increased calcium level in the blood. There will be the increase in calcium level in the blood. So this is the characteristic features of primary hyperparathyroidism. There will be the calcium level is always increased in the primary hyperparathyroidism. We can easily complete the primary hyperthyroidism by the calcium level, because in primary hyperparathyroidism the calcium level will be always in the peak level. So parathyroid hyperplasia and option D are the also cause of hyperparathyroidism, but they are less cause when compared to the parathyroid adenoma. As I said before, CRF, that is chronic renal failure, is a primary cause for the secondary hyperparathyroidism. And we see how that is the patient with CRF, that is chronic renal failure, due to that, because of chronic renal failure, they have a decreased calcium absorption in the kidney. See, if the patient have a chronic renal failure, due to the because of chronic renal failure, the patient will have a decreased calcium absorption in the kidney, and same level, if the CRF is there, then it going to happen hyperparathyroidism also. That is the secondary hyperparathyroidism. So patient with CRF along with hyperparathyroidism. So what happened in the hyperparathyroidism? There will be the increased in the, if the PTH level is get increased, is always bring the calcium level increased. So in secondary hyperparathyroidism, the calcium level is getting decreased and simultaneously it getting increased. That is why the characteristic feature of primary hyperparathyroidism is the calcium level is always increased. So we have another question: which of the following route bioavailability of the drug is likely to be 100%? We have a various route of drug administration in that, which is going to be 100% in the bioavailability of the drug. It is likely to be 100%. We have options of intramuscular, intravenous, subcutaneous, and oral. In these four kind of routes, and bioavailability of the drug is likely to be 100% in IV. See how we are going to characterize this bioavailability. Keep on with that. A fraction of drug. This fraction of drug that reaches the systemic circulation in, the important thing is in unchanged form, in an unchanged format to the site of action. See, the bioavailability is defined by the fraction of drug that enter the systemic circulation in unchanged form to the site of action. So through IV, the bioavailability of the drug is likely to be 100%, because the active effect of the drug that enter the circulation when it is introduced to the body, that is going to be the active effect when compared to the intramuscular, subcutaneous, oral, and